Hello and welcome to our IVF webinar tonight. It's 8 p.m. UK time, so it is time for our next live event today. And I am happy to be here again. And Dr. Rodrigues, hi, how are you? Hope you can hear me well.
Yeah, very well. Thank you. Good to be with everyone.
Thank you so much for confirming this for me. And please let us know that you can hear us both. So we want to make sure that all is working and we can start. So my name is Caroline and I am your host as always. And tonight, again, we are meeting here. This is our next Stronger Together event. And this has been brought to you simply because we want to make sure that you will be able to ask your questions to top fertility experts. We are talking about lots of different aspects of IVF and egg donation treatments. And as you are not able right now, you are not able to proceed with the treatment, we definitely want to give you a chance to ask your questions, to meet doctors, but also join us and, well, it's true, stronger we are definitely together. So that way you can at least get prepared for your treatments. And this also has been we were able to brought it to you thanks to our ambassadors and partners. You can see them right here, all of them are a huge part of our Stronger Together initiative, and this is also possible thanks to them. And tonight we have another topic, and with us already is Dr. Antonio Rodrigues. Dr. Rodrigues is a reproductive medicine specialist and the founder and director of Medfem Fertility Clinic, which is located in South Africa. And today he will be explaining to you and talking about lifestyle and infertility. And he will start with his presentation, and then it will be time for your questions. Remember, you can type them all in the chat section. And after that, after the presentation, of course, Dr. Rodrigues will be answering your questions. So just do it. Go ahead and type them all in so that he will be able to help you. And well, remember also this is being recorded, so of course you will still have a chance to rewatch it. And I guess that would be it from me. Dr. Rodrigues, how are you tonight, and are you ready to begin?
Absolutely ready to talk, and good to be with everyone in this time of a different part of our lives. All of us, it's the same everywhere. We're all sitting in a either total lockdown or partial lockdowns in the world, and trying to stay safe. So I'm really pleased to be able to share this particular topic with everyone. In terms of our particular clinic, we built this clinic in 1991. We've been doing IVF for approximately 32 years. We have a big team involved, and we're in Johannesburg, South Africa. It's the beginning of winter at the moment. We are lucky in Johannesburg. There's always clear blue skies, as you see over that building. It's nice to just share a bit of where I come from so that you can get a feeling of who I am. In terms of the IVF process and our laboratory, and that's not what I'm focusing on tonight, we have a fully comprehensive laboratory managing to do all forms of in vitro fertilization throughout the process that is available anywhere else. We're proud that we get pretty much world-class results. We've had about 22,000 babies born from our clinic over the years, and I must say it's a very rewarding kind of profession. I have a special interest in lifestyle and lifestyle's effect on infertility, and I'd like to just take you through that concept, and then happy to talk about these different aspects of why we need to focus on lifestyle to improve our outcome, both in terms of normal infertility as well as in vitro fertilization. So if we look at this, there's no question that there's a number of factors that are important. And one of the most important ones that we've done research over the last 21 years is stress. Now, stress is, and we'll define it just now, if one is in a stress situation, often the rest of the things that are mentioned there, diet, smoking, recreational drugs, alcohol, and poor nutrition, often follow that whole concept. And the type of stress that we have recognized as a major cause of, or major comorbidity of infertility is what we call time urgency perfectionism stress. And I will explain that just now. So, what is the most important thing in terms of diet? Now, if we look at people's diets, and it's a general statement, but we are very aware whether you are overweight or not overweight, that anything that leads to a higher level of carbohydrates in your diet, and unfortunately all those nice normal things that taste good and are quick fixes in terms of diet, range in the carbohydrate spectrum. And once your diet is full of carbohydrates, you get into a situation where you have raised insulin levels. So normally if you wake up in the morning, your insulin should be low. As you have your first meal, the insulin goes up, it cleans out the sugar in your bloodstream, and then you are maintained until your next meal. But what we found in the work that we do is both in women and in men, a lot of them have raised insulin levels. And this is not diabetes, this is high insulin levels, which is a pre-diabetic state. Some of the patients are overweight, but a large percentage of them actually are normal in weight with raised insulins. And the common symptom is people get tired, they often have sugar cravings, the weight gain is an issue, and as part of that, they also get high cholesterol levels. If we look further into that disease process, the extreme of it is diabetes. But again, a lot of patients are not diabetic. They're pre-diabetes. Some of them have hypertension. Some of them have a history of heart problems. But the bottom part of the slide is very important. In our particular setting, and I think it's a worldwide trend, there's a very high incidence of polycystic ovarian syndrome, or what we call a spectrum of polycystic ovarian syndrome. In other words, some women might have absolutely normal cycles, but in fact, when you monitor their ovulation and you monitor the way their uterus responds, they behave exactly like a polycystic ovary. And the important thing with this spectrum is some of those patients have very high insulin levels, and obviously if they have high insulin levels, they need to pay attention to their diet. And secondary, we treat all those patients with metformin to bring that insulin down. There are also some natural products called inositol, which is used to also bring insulin down. But importantly in that group, where you have women who are actually normal in weight and they've got polycystic ovaries, when you take a history from them and their insulin, and you do bloods on them, the insulin's normal. But if they've got symptoms of low blood sugar, which is really cravings, tiredness, this what we call typical hypoglycemic symptoms, often leading in some people to migraines, those patients also need to be managed with metformin. And metformin is a drug that will help egg quality. So if we look at polycystic ovaries in the broad spectrum, and that is why we discuss insulin, that group of patients can often go through an IVF program and have poor quality eggs that come out, and it's blamed on the polycystic ovaries. If effectively you need to get the metabolism right to enhance the quality of eggs. If we look at the next slide, what about the male? About 15 years ago, we found that 15 to 20 years ago, we found that we were blaming poor quality embryos on the egg. It was a general tendency in the IVF world. Poor embryos equals poor egg. What we started to do is we paid more attention to our males. When we do tests on men, you'll find some men will have absolutely normal semen analyses, nothing wrong with them, they look fine. And on the other spectrum, they can have very low sperm counts and very abnormal sperm. And if they have high insulin levels, what we found is it played a big role in embryo quality. So when we're looking at IVF, it's very important to bring the male into it. And we've had a very specific interest in this particular field. We've done a lot of research and presented a lot of papers and written a chapter in a book overseas. If a male has high insulins, and we check things like thyroid and prolactin levels in a male, and if any of those are abnormal, you have to focus on the male. It's not all about eggs. And just to put that in a bit of perspective, if you've ever been through an IVF process and you've had very good embryos up to day 3 and embryos that become very poor after day 3, one needs to focus on the male as well. And by doing these tests and managing the male, you can get better quality embryos and a better outcome. If we then go into what is the best way of eating, I think it's really a simple philosophy. If your weight is normal and your insulin's normal, you need a balanced eating plan. And depending on what your type of food is, it means you need to eat a combination of food, vegetables, fruits in the right amounts. And that's the biggest thing, is right amounts, and watch the overdose of refined carbohydrates. If you have high insulin levels, then you've got 2 options. You need to look at a low glycemic diet, which means a diet that you're eating your sugars and carbohydrates in such a way that they don't create this big high in insulin levels. And that works pretty well in the female population. And then there's a diet called the Banting diet, or the carbohydrate-free diet. And that particular diet has a very specific benefit, but seems to do better in the males in controlling insulin levels. So I think it's very important to focus on eating habits and to keep it simple in such a way that you're eating healthy. The other thing that we noticed in our work over the years is that in the modern type of foods and the modern diets, nutrition the intake of nutrients plays a role. If we're sitting in a scenario where you're having very good food, in terms of both vegetables and fruits that are developed in a situation where they're allowed to grow slowly and it's organic and you're eating well, those type of foods will be full of nutrients, and there's no necessity to look at enhancing your nutrient intake. We do believe that the patients that we see need nutrients, and we use nutrients in relation to what we call mitochondrial stimulation. Now, mitochondria are these little parts of the cell cytoplasm, and they're very important in creating the division in the egg at the end of its development. And if the mitochondria don't have the right doses of vitamins, minerals, amino acids, antioxidants, and your growth hormone factors, then effectively it won't have the ability to enhance the way the nucleus of the cell and the division of the cell happens. And time, urgency, perfectionism, stress, the stress of modern life, plays a big role in creating the problem where we overuse our mitochondria for energy, and that whole system needs to be put back into a synchronized state. We do have a product that was created specifically for this, where we packaged all those things that I mentioned into 4 tablets, and patients take that. I know for a fact that in Europe there are similar products, and I think it is important to have something that combines growth hormone stimulators, antioxidants, vitamins, minerals, your amino acids, and obviously there's the vitamin D story. A lot of people are vitamin D down. That is not included in this, but should be taken. If we then go to a subject that we have done a lot of research on, we wrote a book 21 years ago called Faster, Better, Sicker. So the faster and better you are, the chances are that you're going to have certain things happening to you because of that. And this type of stress is very much a successful stress. Most people who have this type of personality, where we're on the go all the time, in fact, do very well in life from a success in the work they do from a materialistic point of view, but it does create a big problem from a body point of view. And if we look at this type of stress, and this is just mentioning that, again, we've done a chapter in an international book on it, and we also have an online stress course. If you want to have a look at it, it's called www.tups.co. It's a 10-week stress course that's available for anyone who would like to do it online. And what it does, it looks at this stress factor called, first of all, time urgency, and in simple terms, that feeling that you're always chasing time from the moment you go to sleep at night. You're even chasing time in your sleep patterns, in your nightmares, in your dreams, waking up before the alarm clock goes off, and never seem to have enough time. We call that time urgency. And the next factor that's very important is perfectionism, where you would go on and on in a normal situation to get something perfect. When you marry these two, perfectionism and time urgency, the problem with that is there's not enough time to be perfectionistic, and that starts to create certain hormonal changes in the body. And we noticed there were two factors that were important in this group of patients. The one we call scarcity, and that is really, in simple terms, too little time, too little resources to be able to carry out your perfectionism and to do it on time. And often this group of people, in terms of their symptoms, are angry, irritable, hostile, often cynical, and they're in that mode where they blame other people, etc., etc. And it's all related to the stress of not having enough time to do things right. And a very important thing that we found in our research was the personalizing personality, that person that takes things personally in relation to this time urgency perfectionism. And that group of people were important because they have a much higher incidence of being depressed. But what was exciting when we started to manage the group of people that have this, that depression, in fact, lifted in a lot of those patients. And that is quite dramatic and very rewarding to see people change the way they manage their stress and, in fact, start to feel better as human beings. So what is it all about? What is this time urgency? So we look at a situation where we get hooked into a stressful situation. So any situation that causes a negative reaction. If we look at this slide, it could be that you're running late, that you're being criticized, that you're standing in a queue, that someone's moaning at you, that you can't cope with your children because they are struggling. Those are all hooks that will pull you into a situation and start to create a negative reaction in your body. And this negative reaction, we created what we call a time urgency stress cycle. So something in that cycle will happen. For example, you'll suddenly feel nervous and your heart rate goes up. You'll start to say negative things to yourself. You might scream and shout, or you might start to cry. There's a reaction related to that. And the whole principle of managing this is to teach people how to break that vicious circle. And we teach people within that circle, whether it's the physical, the self-talk, what you say to yourself, how you think or your behavior gets managed. Not by changing your personality, so that the idea is not here to take people who are time urgent perfectionists and make them something else. It's to make them less stressed in terms of their reaction to the stress, how they think about it, and how long they stay stressed. A very rewarding concept. Now, why do we do all of this at the end of the day? The first thing is we recognize that there's good stress, and all of us like good stress. And good stress is what happens there. It's an unlearned stress. It happens out of nowhere. And that stress releases adrenaline. You feel good. Let's say you put a project in at work and you get rewarded for that. That's adrenaline. Even if someone happens to die in your family and you need to manage their funeral, that whole process is not a negative thing. You are managing something and you're getting a reward by respecting that person. But your learned stress, which happens all day, every day, from the time you wake up to the time you sleep, and as I say, in your sleep as well, secretes two bad hormones, and the one is cortisol and the other one is noradrenaline. The cortisol is an immune suppressant type of hormone, so that leads to a lot of things. That leads to infection, it leads to chronic immune diseases, autoimmune diseases, and plays a big role in the whole process. And then your noradrenaline has a lot of symptoms that it can bring out. When we were doing our research, we noticed that in this group of women, and it was mainly women at that time that we were testing, and it was women who had infertility problems, and a lot of them had endometriosis. There was a large group of symptoms that they had. And again, if we look at the graph there, lots of these symptoms, and often multiple symptoms. But once you manage that stress, those symptoms went away, whether that's heartburn, chest pain, headaches, muscle pain, joint pain, diarrhea, irritable bowel syndrome. Those things disappeared, and there was a lower rate of depression after managing it. So from our point of view, there's a value for the patient, not in terms of just falling pregnant, but in adding value to that patient in terms of their pregnancy, because there's a lot of work that shows if you fall into this type of bracket of stress, as you go through pregnancy, it has a negative impact on the baby in terms of almost a hyper dosage of noradrenaline and cortisol, and can have negative effects into the future. And why do we focus on it? Because there's three important things that are highlighted in this. We see a lot of endometriosis in South Africa, and I know that in Europe, as a general principle, if you don't have any symptoms of endometriosis, in other words, pain, discomfort with your periods, pain with intercourse, usually there won't be any surgery performed unless something is seen on an ultrasound, or unless the doctor can feel something on a clinical examination. But the patients that have this have a very high incidence of endometriosis. And if you manage that endometriosis, both by stress management and surgery in the right patients, then they have a better pregnancy rate. We also do post-intercourse tests. It's not a routine test worldwide, but we see a lot of patients where their mucus at the time of ovulation is poor, it is hostile, it's killing off the sperm, and endometriosis and this immunological problem related to stress plays a role. And we also see a lot of autoimmune disease. That's your thyroid antibody disease, some anti-nuclear antibodies, and all those type of antibody diseases reduce your pregnancy rate with IVF. So we like to have this lifestyle management to try and optimize the outcome in these patients, to improve not only pregnancy rate, but what we feel as fertility specialists, the goal is to try and actually get them to fall pregnant as quick as possible. And we call that time to pregnancy. Our goal in modern fertility is your time to pregnancy needs to be reduced down to the minimum times, so that patients come in, go out with a reward of a baby. When we did our study on this, there was a definite decrease in symptoms, but an increased rate of pregnancy in that group of people that were treated. That's just going back to the course, which you can do online. And what it actually does, there's a very extensive pre-course questionnaires where we look extensively into stress, into whether there's depression, whether there's over-anxiety. We also look into a nutritional plan, and once that there's a report that's given out, and then there's a course that goes through 10 weeks, and there's a post-course questionnaire to deal and see how you've done in terms of outcome. So where do we stand? In terms of our particular interest in this is we felt that IVF cannot just be repeated over and over again. Every single failure needs to be looked at carefully. So we bring this type of optimization of fertility into our programs very early. And we do it by what we discussed: stress management, trying to get balanced eating, managing insulin problems in males and females, and diet in males. We mustn't neglect the male. They need to understand they need to be fit and healthy to create a good embryo and a good fetus at the end of the day. Obviously, smoking has been extensively studied both in males and females. And if you do smoke, there's going to be a reduction in your IVF pregnancy rate. Recreational drugs have an effect, and obviously alcohol. And alcohol plays more of a role if you're not in excessive alcohol. It tends to play a role in diet, especially if it's wine and things like that, because that's very high in carbohydrates. But alcohol, obviously, in excess has a problem. So in summary, I think it's very important as an added benefit to all fertility patients to focus on these things to optimize their fertility. Thank you.
Fantastic. Thank you so much for providing us all the details and what we should avoid, what we should look out for. Excuse me. And now, of course, it is time for your questions. Just let me remind you that you need to just type them in the chat section, and Dr. Rodrigues will simply answer them for you one by one. And are you ready for the questions, Dr. Rodrigues?
Absolutely, absolutely.
Perfect. So let's start with the very first one. What do you suggest for improving egg quality?
So I think there's two important things. Everything I've spoken about already is important. So I also think, and again, it depends on whether in your fertility clinic they're looking for things like insulin, thyroid, prolactin. They usually are. Those things are very important and play a role. And also the secondary part is we mustn't always blame the egg. And back to my talk earlier, we need to focus on the male as well. If they haven't had those sort of tests, fasting insulin, thyroid, prolactin in a male, they should have those tests done. And if they're wrong, I've seen patients that have multiple IVF treatments for poor egg quality. It is suggested that they go for a donor egg. But when you manage the male and you treat the male and get those parameters right, you can actually improve the egg. Lastly, if you've had IVF and you've landed up with poor eggs, one needs to review the type of stimulation you've been having. What is important is that if you're having poor eggs in terms of IVF, where they're using normal doses of eggs, it's often a very good idea to drop those doses right down and start to use smaller doses. And that those stimulation protocols that vary are very important as well. At the end of the day, if you're having IVF for a reason such as a blocked tube and they keep having poor egg quality, there's always the option of natural IVF, because sometimes some patients just don't do well with injectables. And if you go to a natural egg, they make a beautiful natural egg, create a natural embryo, and we land up with a baby from that.
Okay, fantastic. Thank you so much for your question and your assistance with it. And there's another question right here. So why is weight always a factor for IVF and fertility generally? I know so many overweight women who are pregnant naturally.
Yeah, so if you look at it from a point of view of IVF and weight, the one factor, if you're overweight and your insulin levels are high, that will definitely influence your egg quality. That group of people need to lose weight. Actually, it's not even a weight thing. They need to actually get their diets right so that their insulin levels are controlled. And once you control the insulin level, even if they are overweight, they can have a baby. So it's not actually the weight. It's the weight because that's what people look at in research projects. They say women who are overweight have a lower chance of pregnancy. It's actually the control of insulin. So if you control the insulin, be that by a diet or be that by a diet plus medication in the form of metformin, then you don't have to be a skinny person to have a baby. And I agree with you. There's a lot of overweight people, but they often have a different spread of weight. And often when we test that group of women, they have a normal insulin levels. So insulin's the crux rather than the weight.
Okay, excellent. Thank you so much. And there's a follow-up. So what do you mean by natural IVF?
So natural IVF is where a woman has a normal cycle. So if you monitor her, she creates a normal follicle. And I'm sure you all know the follicle is a collection of fluid with an egg in it. If she has a normal follicle and her endometrial lining, the lining of the uterus looks good, we would then take that natural egg out. So it's exactly the same as IVF, and we're taking out a natural egg without the drugs. And there is a group of women who need to have that form of treatment. And the two groups that we do it in is one where we keep trying to get eggs from someone and we land up getting one egg at a time, so we're not getting numbers. We will often go to a natural IVF, especially if there's a male factor involved. And the other group is where you keep having poor quality eggs in normal stimulated cycles. It is a way of in some women, you will get an absolutely normal egg without the drugs.
Okay, excellent. Thank you for explaining that. And we will go to insulin. What is the normal level of insulin?
So the normal general level is less than 9, depending on the units, but most places in the world use those units. So it needs to be a fasting insulin and it needs to be less than 9. If we're really normal in terms of our insulin, when we wake up in the morning, it should be about 4 or 5, but you want to reduce it below 9. And it is a really big factor in this whole story and needs to be addressed. It often is ignored, but it needs to be addressed.
Okay, perfect. Thank you for providing those details as well. Okay, there's another question. Can you reverse endometriosis by managing stress, or will you need to operate and then manage stress to prevent it from recurring?
So in our particular practice, a lot of the women they don't have tubal disease, and a lot of them their husbands have normal sperm. So in our particular practice, if we find someone has poor mucus, we will take them through an operative procedure firstly to clear up that endometriosis, and then we will try and get a natural pregnancy. Also, if you do have underlying endometriosis and you've never had a laparoscopy, and I must just emphasize in our particular practice, 90% of women don't have symptoms of endometriosis. They don't have pain, they don't have discomfort with periods or ovulation, and they don't have painful intercourse. So we wouldn't know unless we did that mucus test and unless they fitted the picture. We tend to do a laparoscopy. And the other thing is that about 15% of patients who have recurrent failed IVFs, if they've never had a laparoscopy, they might have an underlying endometriosis, and it might be actually affecting the quality of the eggs. So those things are all real. The answer to can you manage stress to prevent it recurring? If one manages the stress and keeps to that, there's no question a lot of those patients fall pregnant naturally before you do any form of intervention. And we've changed people's lifestyles for years that we've known for 20 years now that managed to change their lifestyle and maintain their lack of symptoms.
Sounds great. Thank you so much again for that answer as well. And now let's go to the next question. What to do about painful ovulation? Every month I have a dual pain for 24-48 hours.
Yes, so again, if we look at it from a symptom point of view, that can indicate that there might be endometriosis. It could also be normal. So just to explain what happens during ovulation, the first thing is that you get the follicle getting quite distended and tense. So that can be sore. I mean, it has a very, very strong nerve supply, the ovary. And in a certain group of women, when they release that fluid into the abdomen, it has a high level of what we call prostaglandins. And these prostaglandins are quite vicious in terms of the abdomen. And if there's any blood in that fluid, it's also very painful. and you can't do much about it. And again, the problem is that the treatment for that is an anti-inflammatory, but it's generally recommended that you don't use anti-inflammatories around ovulation because it might affect the way the egg ovulates. But it can indicate that you have underlying endometriosis.
Okay, thank you so much again for that answer. And okay, there's another question. Is there any truth to believe that things like Brazilian nuts, okay, pineapple and salty food assist with infertility?
Well, I suppose I'm not too sure about the salty food, but the other two in a balanced way could be part of a balanced eating plan. You know what the problem is with all of this? If we look at it and if we read the internet, and everything is good for infertility. And I think the reason for that is because at that moment in time for a patient who's gone through a struggle period of trying to fall pregnant, they will read about something, and in that particular month they'll take Brazil nuts and pineapple, and they fall pregnant, and that'll become the story. So my personal feeling is take the right nutrients, balanced eating plan, and you can't do too much of that, and try and manage your stress as a general principle.
Okay, thank you so much again for that. There are more questions coming. So next one is this. Does DHEA improve egg quality?
So DHEA, what it is it's a male type hormone that's normally secreted by the adrenal gland, and it is used to increase the number of eggs in IVF programs, and there's some work to suggest that it has a benefit in people who have low egg reserve. The problem with DHEA in people who have normal egg reserve, because it's a male hormone, it can actually bring on a polycystic-like ovary and can have the opposite effect. So there is a place for it for the right patients, and if it's recommended by your doctor, it's fine. But per se, improving egg quality, my personal feeling, it's not my favorite drug because of its effect in some women on male hormone and its effect on producing a polycystic-like picture. But if you're falling into that group of patients who's right at the end of their egg reserve, there's definitely no harm in taking it. And in some people, it definitely plays a role in improving outcome.
Okay, excellent. Thank you again for answering that and providing the details, how it actually works. Definitely interesting. And next question is, for what type of patient group would you recommend inositol?
Yeah, so your inositol is a natural insulin-reducing drug. It's got folic acid, normally the combination of it in, which is an antioxidant. So again, it's going to be your patients with polycystic ovarian syndrome. But just to put that whole polycystic picture into perspective, it is quite a spectrum. So you go from a patient who, when they have a scan, it looks like they're ovulating normally and the endometrium's okay, but they've got what we call a multicystic ovary. So the dominant egg hasn't actually switched off all the other eggs. That is actually the sort of one end of a multicystic polycystic picture. And then you go right up to your patient who has true polycystic ovaries without any periods and without any menstruation and without any ovulation. All those patients do well with inositol. And it is a good medication to use in that group of people, and has been scientifically shown to have benefit. Yeah.
Okay, thank you so much again for that. And this is another question here. What are the main reasons for non-implantation if you have done all that you can to improve egg quality and ended up with good viable blastocysts?
So I'm going to make an assumption by good viable blastocysts. There's also the situation where those blastocysts have been tested. So if they haven't been tested and you've got no implantation, we tend to look at quite a lot of the poor implantation factors before we put patients on programs. So we do screening antibody tests. Anti-thyroid antibody plays a big role in poor attachment of embryos. There's antiphospholipid syndrome, anticardiolipin, and your anti-nuclear factor. Those immunological factors are about 15% of our patient profile in South Africa. So we do test people up front. If we're talking about good viable eggs, blastocysts, a good viable blastocyst might look like a good blastocyst. So we will often recommend that that patient undergoes pre-genetic testing. If we do pre-genetic testing, and we've looked at obviously uterine factors, whether that's by X-ray or by hysteroscopy, very important to make sure that there's no blocked tube anywhere. If there's a blocked tube at the end of the tube, we call that a hydrosalpinx, or water on the tube. That can also be lack of implantation. So if we make an assumption that we've done all of those things and we've tested the embryos, it's unusual not to get implantation. So I think if the embryos haven't been tested, they should be. And I think you need to have some immunological tests to make sure that everything's all right. And in your workup, you must also be sure that you don't have any blocked tubes from a water in the tube point of view, and that you don't have anything in the uterus that can be inhibiting it. There's a very, very small group of women who an embryo can't implant in. It is really small, and those patients often need to go to surrogacy, but that's a very small group of people.
Okay, excellent. Thank you so much again for your advice on that. Okay, let's get to the next question. Can your blood sugar be low whilst having high insulin levels?
Absolutely. So that's the whole thing. So the spectrum of high insulin not being diabetic. So your blood sugar levels are normal or low with high insulin. So what effectively happens when you wake up in the morning, if your insulin says 15 and you have your breakfast, that insulin will go up to 40, 50. And because it started off at 15, it actually drops your blood sugar. So what will happen 2 hours, an hour, 2 hours afterwards, you're going to feel a little bit of a sugar low, you're going to feel hungry, you might feel shaky, you might feel tired, it might settle for migraine. And if you eat something, you feel better. So it's exactly what you're talking about. Blood sugar is actually low with high insulin. It only becomes high when you become diabetic. And the reason it does that is you've overused your pancreas over the years. And the pancreas then it carries on secreting insulin, but the insulin stops working. So initially the insulin, when it's high, overworks and therefore drops your blood sugar. And with time, it stops working and it can't get into the cells, and you'll end up becoming diabetic.
All right. Again, thank you so much for answering that question. Okay, next one is right here. Does ubiquinol make any difference to equality and fertility as well?
Again, there's definitely some studies that suggest that it might make a role. But, the problem with the studies is that once you put all these, the small studies often show one or the other, but when they put all the studies in the world together, they often don't show anything. I think it's very important just to mention that when you are going to a fertility clinic, you're there for a reason, and it's usually because you feel comfortable and that you feel comfortable with the medical people that are looking after you. And different doctors have different experience with these sort of things. And if your doctor's on the page that he believes that it has a benefit, then go with your doctor, and believe in it. I don't have a big experience with ubiquinol.
Okay, perfect. Thank you so much again for that. Now, this is interesting for sure. So what is your opinion on PRP?
Yeah, so in terms of the uterus preparation and trying to get the uterus better, we've had a few patients of benefit. In terms of the ovaries and enhancing the ovaries by injecting it in the ovary. In South Africa, there's one unit doing it. It's not very impressive, the research, and we kind of refer to the one person. and if patients make a call to do it, they do it. So not the best experience from my point of view, but there is literature to suggest that it has a benefit, but we haven't had that same experience.
Okay, thank you again for that. And there's another question here. What is the best natural way to address short luteal phase, someone with cycles of 21 to less days?
Yeah, so one's assuming then that a scan has been done and it's been confirmed that ovulation has taken place on day 14 and that you've got a shorter cycle. If that hasn't happened, it's very important to know when you're ovulating, because your luteal phase by definition is 14 days. So if you look at a 21-day cycle, you could be ovulating on day 7. This is classically in women who have low egg reserve. Having said that, you can still fall pregnant if you're ovulating on day 7. True luteal phase deficiency is quite rare. And the first step in it, if you are ovulating on day 14 and having a short cycle, the first step is to actually have ovulation induction. And the better route is usually injectable FSH, LH combinations, and with progesterone support. So that would be a way of trying to improve the way the egg creates the follicle, because as we know, when that egg releases, the progesterone is made from the follicle, and in order to improve that, the preluteal use of injectable FSH and LH together with progesterone might fix the problem. But in reality, this is quite a rare problem. We don't see it often.
Okay, thank you again for that. There are like 2 questions left, so we will be slowly finishing. But of course, if you have any questions, this will be like a final call for your questions. So go ahead and type them in. And next question for you is this one. Can caffeine 3-4 caps a day prevent a pregnancy?
So it's always been said that too much caffeine can play a role in pregnancy. There have been some very big studies done that if you're having more than 3 to 4 cups of coffee a day, you will have a problem with fertility. Now, usually if someone's having a large amount of caffeine, they're not eating properly. So if I think, in other words, the caffeine is replacing the diet. So I think you should limit it to 1 to 2 cups a day, but there are studies to show up to 4 cups won't do anything to pregnancy. You must understand that caffeine is a drug. So if you're having very strong coffee with caffeine in it, the baby's going to get that caffeine in it, and it's that might affect the actual baby once. Well, that's in terms of pregnancy, but in terms of falling pregnancy, the caffeine of more than 4 cups a day, there's some work to suggest it. But I'm not too hooked on caffeine, so long as people are having a balanced eating plan and they're not using it as food, which a lot of our patients use it as food.
Okay, excellent. Thanks so much again for that. And there's another question right here. Can you get insulin levels tested and treated by GP, or is it preferable to go to a gynecologist?
I think if you've got a good GP and they do an insulin level and they understand the situation, which, medicine takes a long time to change. We've been treating insulin in females for 20 years. The endocrinologists who are the specialists in hormones, they've been sort of came on board about maybe 8 years ago. Before that, they thought it didn't play any role. So if your GP understands insulin, then the GP can treat it very simply with metformin and helping you on a diet. But a lot of the patients' diet alone is not going to do it from a fertility point of view. And metformin or glucophage is the name of the drug here, is really almost a wonder drug for the right patients in terms of egg quality and outcome.
Fantastic. Thank you so much once again for explaining this. And at least for now, it looks like it is our last question. Okay, but if you have any left, you know what to do. Okay, let's get to this. Does vitamin D deficiency has an impact on fertility?
So again, there's a lot of work to suggest that it does play a role. What was happening for a while in the world, they were doing vitamin D levels, and they were finding that suddenly everyone in the world was vitamin D deficient, which could be the case because we've been taught that, we're supposed to not sit in the sun and enjoy the sun. But they've actually changed the values worldwide, and they've increased, so the normal values in terms of what is actually vitamin D deficiency has changed. But if you are found to be vitamin D deficient, you should have the replacement because it has been shown to play a role.
Excellent. Thank you again for this advice and explanation. And in the meantime, we received another question, so let's get to it right now. I am always cold, hands, feet, and nose. If this is poor blood supply, could this affect egg quality?
So effectively, if anyone tells me that, they probably have an underactive thyroid, and I would like to mention this very strongly. The cold hands and feet, and if you take your body temperature, and if it's below normal, if it's under 37, and you've had that for a long time, it often is an underactive thyroid. Depending on who you're seeing, from a fertility point of view, the level of thyroid stimulating hormone, which is the hormone that's made by the pituitary gland to make the thyroid work, should be more than 2.5. Now, some doctors will, from a medical clinical point of view, 4.5 and above is abnormal. From a fertility point of view, 2.5 is abnormal. If you'd have an ultrasound and your lining of your uterus is thinner than 8 millimeters at the time that the follicle is normal, then we need to start thinking of thyroid disease. So you should have your thyroid checked. You should also have thyroid antibodies checked. And if your lining of your uterus is thin and someone's struggling to get it right, thyroid plays a big role in that whole process.
Excellent. Thanks so much again for this. In the meantime, there were 2 questions as asked, so let me go to them. During COVID-19 lockdown, when should we be able to visit gynecologists again, specifically for your clinic, as we are based in Johannesburg?
Yes, so basically, from Monday next week, our clinic will be fully operational.
So next week, Monday,
everything's going to be back to normal. There are certain rules in terms of the COVID lockdown. We're going to manage them in a very scientific way, and really from a COVID point of view, it's pretty simple. You need to have your social distancing. If you're 1.5 meters away from someone, the chances of you getting infected are close to zero, because we must remember that this virus, when it's a droplet virus, so when you're spreading it, whether you're sneezing or coughing, as it leaves your mouth or nose, it's already traveling downwards. It doesn't travel straight because it's heavy. By the time it gets to 1.5 meters, it's going to be on the floor. So if you stay away from someone, and in South Africa now, it's going to be a rule that if you're out of home, we have to use masks, and that's not surgical masks, it's cloth masks. And if you manage your hand hygiene well, and we've got systems in place in our practice where we're only going to see people at a certain time, only one person at a time. We're going to be doing a lot of Skype consulting as a way of consulting, and only take patients in the room to do their ultrasounds and to do their procedures to limit their risk in terms of getting infection. But we will be carrying on with IVF.
That's excellent. And someone wanted to know that you already have answered. So Monday is the day you can, in fact, you are able to simply get an appointment, and the clinic will be opened. That's great. And their patients definitely are happy about it. And there's another question here. Is it possible to diagnose an infection in uterus by testing a menstrual blood?
Yes, so there is a trend to worry about uterine infection in people with recurrent failed in vitro fertilization. There's people who are looking at exactly is the timing of putting an embryo back a problem or not, and there is some work happening at the moment in terms of either failed IVF or early miscarriages. But that is a very specific test because if you have an infection in the uterus, that's a true infection like chlamydia or those sort of infections, you will have bad symptoms. But there is a group of patients that have what we call microbiomes. So they have the change in the microbiology of the uterus, and that requires a very sophisticated test, and it's quite expensive to do that test. So it's for the right patient. It might be necessary. In terms of menstrual blood, the one thing that can be picked up is TB, but in Europe TB is quite rare, as you know. It's in certain parts of South Africa it has a high incidence, but it's not common in the group of patients that we see.
Okay, thank you so much again for helping out with the question, and actually all the questions. It looks like we are done with the question. However, someone is still typing, so let's give it a second and wait. But anyhow, we will still be finishing shortly. And well, yes, actually there's another question, so let me just get to it. Are skin tags a symptom of PCOS, and how can it be treated?
Yeah, PCS obviously is more a acne-like, if it's severe, can bring acne-like problems. Skin tags themselves have never been related directly to PCOS. But if you have a lot of acne in the area, it can create problems with the skin, I have no doubt. Unfortunately, the only way is to really to either cauterize them or take them off by some form of surgery.
All right, perfect. Thank you so much again for that and for all your questions. And Dr. Rodrigues, thanks so much for joining our initiative, joining us tonight, and for your time and explaining all the details about lifestyle and fertility, providing us so many details, but also tips. So thank you so much. Definitely interesting. And well, there are no more questions, but definitely you should see some comments. Thank you, doctor. You are amazing. Thank you so much. There are more.
Yeah, wonderful.
This was
It's a
very good.
pleasure. Been a pleasure.
Yeah, there are more of those, so I just need to show you this. Oh, sorry. In the meantime, there's one more question. You mentioned thyroid under function. What can be done about that?
Yeah, if there's going to be any form of treatment in terms of infertility that is highly rewarding, it's treating it underactive thyroid. And the reason for that is you're going to take a little pill a day. It's going to cost you in South Africa 15 Rand, and you know how what that would cost overseas, nothing, for a whole month's treatment, and it'll fix your uterus, create a better quality egg, and give you a baby. If your thyroid's underactive, it's one of the most, and that's often in some people the only problem. It's one of the most rewarding things to treat.
Okay, perfect. Thank you so much again for answering that last question. And well, there are more thank yous. Dr. Rodrigues, is there anything at all you would like to add?
Yeah, I think under these COVID times, I think people have had a lot of time to reflect maybe on their lives, and maybe time urgency and all the things we chase after and all the things that we're forced to do just because that's the way it is to be so-called successful. One needs to just become a little bit introspective and look after yourselves and manage your life and enjoy your life. And I think that's the message. And just in terms of diet, I think diet plays a role. You can still enjoy life and just be careful with the carbohydrates. And it's been great being able to share this experience with you.
It has been a pleasure to have you here as well. And someone already also asked if you are offering consultation over Skype. I believe you do.
Yes, we can do that.
Exactly. So even because someone has asked about being in England and asked about this, so yes, it's possible. And just let me remind everyone that you can simply click on that link right here. I have sent it to you via chat, and you can ask your questions right there. And all those questions requests will be sent directly to Dr. Rodrigues and his team, and I'm sure they will be able to get back to you as well with some advice and some answers, and possibly organizing a Skype consultation for you. Okay, thank you so much again. And let me just remind everyone that we will be back here tomorrow at 8 p.m. UK time. So only one event, but stay tuned. We have another topic to tackle tomorrow. So hope you will be able to join us as well. Thank you all for joining us over and over again. And of course, you will be able to watch this event on our website, myivfanswers.com, also with the link I have sent to you right now as well. And again, Dr. Rodrigues, thank you so much. Have a lovely evening, and well, hopefully we will be able to do it again. It was a
Absolute
pleasure.
pleasure. Thank you.
Brilliant. Thank you.
Stay safe, everyone. Stay safe.
Stay safe. Exactly. Bye.
Bye.